You're listening to Health Professional Radio. My name is Wayne Buckler, and my guest today is Dr. Steve Hambleton. Steve's the chair of the National eHealth Transition Authority, known, I think, far and wide as NEHTA. Welcome to Health Professional Radio, Steve.
Thank you very much.
Now, Steve, the National eHealth Transition Authority is a mouthful in terms of a title. What is it that NEHTA does? Where does it fit into the system?
Well, NEHTA's been around for about 11 years now, and it was tasked with transitioning Australia to a fully functional e-health system. And I guess it's been quietly beavering away in the background doing that, building the infrastructure that we need so that we can communicate properly electronically. And right now we're about to see the fruits of that labour. We do have a national infrastructure that we can rely on, individual health identifiers, individual doctor identifiers, a method of describing disease, which is used internationally, SNOMED CT, a way of describing medications, the Australian medicines terminology, and messaging protocols. So that's the rail gauge, and if we can get traffic going down those rails, we will start to see some of the benefits that we know we can get from better communication.
Now, all those infrastructure blocks and information blocks would sound kind of obvious to the outsider. You know, a way to describe medications and a way to describe disease and conditions. Has that been a difficult task to get those pieces in place?
Well, it has really. I mean, if we look at internationally, there's pockets of brilliance all over the world. I mean, if we're in Toronto, we'd be very happy with our state system, but it doesn't talk to the rest of the country. If we're in the United States, we could see pockets where there was absolutely brilliant work, and Kaiser Permanente's, after a failed start the first time, has really put together something that's really amazing. Australia, getting the whole of Australia to agree on one set of standards, did take some time, took a lot of work, and I guess has been where most of the money's been spent. On top of that, we have the personally controlled electronic health record, which leverages off some of that infrastructure so that we can share information in a structured way. So it has been quite a difficult journey, but we're, as I say, about to see, I guess, the benefits of that work.
Now, lots of our listeners are clinicians of one sort or another, mainly in acute care, but we spread out a bit into other fields as well. They've probably heard of NEHTA because it makes the news from time to time. What are the things that are going to change their life as this infrastructure rolls out?
Well, I think we'll start to see some differences pretty quickly in their lives. We know that nationally now there's about 2.2 million Australians registered with a personally controlled electronic health record. We know that our public hospitals around the country, many of them are able to upload discharge summaries to that record, and that information will benefit the GP who'll be able to get it quickly. But the reverse is also true. Once we start uploading shared health summaries, an up-to-date list of medications, an up-to-date list of problems that the patient has, and an up-to-date list of allergies that are actually coded and importable into the clinical systems, we'll see lives start to improve. Queensland, for example, has built a viewer, which has actually been rolled out already across over 200 sites in Queensland, which can look at the PCHR. It can also look at other hospitals and other repositories within Queensland Health. But with one click, you can get access to that good summary information the GP has provided to the patient to actually facilitate their transfer into hospital. This is something that I think that people will start to use more and more as we see more and more useful clinical information being put there.
The rollout of that kind of integrated electronic record, are there risks involved? I guess I'm really asking, what's the other side of the coin? Is there an argument against it that's coming from anyone?
Look, I think concerns we've had about safety and security of information have been something that NEHTA has been very careful to work on progressively over the years. And again, it's been 11 years. Security is very important to people. Privacy is very important to people. This is health information, so it needs to be as bulletproof as your banking information. And that's the sort of technology that's being used to make sure that it's carefully managed. I guess health professionals individually know about privacy and know about the importance of privacy, and those principles have been built in. So you can't look at the personally controlled electronic health record unless you're a registered health profession. But more than that, you need to have your health provider organisation registered. You need an individual practitioner identifier to be there, and you need to have those security keys loaded onto your system. Now, if you work for an organisation, they can actually facilitate that for you. And we track who goes there. We know who's been using the product. Those things are built in. For patients, who are keen to be careful about their own information, it's built in that they can look at it via the MyGov website, and there's two-level security with that, and that makes sure that the information is very secure. So security and privacy has been built into this product. Controls are also built in so that patients can actually limit who can see their information. They can limit it to just one practitioner. They can limit it to only the practitioners that have their personal access code. Most people, however, actually allow any registered health professional who's got business in their record to have a look at it. So those privacy issues were something that took a long time to work through, and part of the reason why a lot of this infrastructure has taken so long to roll out.
Steve, that issue of security and privacy is getting a bit of traction in national media. I noticed the other day, I think UCLA Medical Centre had a few million medical records stolen in a hack. Is there reason to believe that the system in Australia is more secure than some of these other people who have suffered these illegal accesses?
I think our system has been built with the most modern security technology. So I know about our system and the levels that NEHTA and the professionals have gone to protect the privacy of individuals, and I think it's very secure. It's built on the government, behind the government websites. You need individual accreditation to get into these systems. You can't, of course, protect against rogue individuals, but we're talking about registered health professionals who know about privacy, who respect privacy, and I think Australia's built a product that it can be proud of.
Dr. Steve Hambleton, that's probably a very good point to finish on. We will expect to see the rollout of more and more of eHealth in the near future, you say. What sort of things are going to be publicly visible?
Well, I think the first thing that you'll see publicly is that the government has just reinvested another $481 million over the next 4 years in eHealth. It confirms that eHealth in Australia has a future. There'll be a new NEHTA will finish up in July 2016 and be replaced by the Australian Commission for eHealth. Now, that'll have a different governance structure, more clinicians on the governance at the governance level. We'll work on making sure that the system is easier to use. We want to share private and public pathology and radiology to minimise that duplication. We want to see meaningful use. We want to simplify the use for both hospital acute care doctors and also general practitioners. And we know that once we get past that critical mass of people and we're moving towards an opt-out system rather than an opt-in system, there'll be something there when you go and look. And if that's the case, we know from our experience in the Northern Territory that the use of eHealth and that, in fact, the way it's built into the way we actually see patients will solidify this into the future. Look, there's huge savings to be made in Australia. For example, we know that there's something like 2 million episodes of medication misadventure in this country, and we should be able to cut that down substantially. Something like 230,000 admissions to hospital result from those errors, and it's an enormous saving if we can realise it. And sadly, we see almost 20,000 deaths, and I think we can cut that down substantially just by sharing information more, in a more efficient way. And as I say, we're on the verge of that now.
Dr. Steve Hambleton, Chair of the National eHealth Transition Authority, thank you for being with us this morning. I appreciate your time, and it's been a pleasure discussing NEHTA with you.
Thank you very much.
This is Health Professional Radio. My name is Wayne Buckler. If you've just tuned in, then you've just missed my conversation with Dr. Steve Hambleton. However, the good news is we have a transcript on our website. There's also an archive of the audio of this interview on SoundCloud and on YouTube. This is Health Professional Radio.